A very warm welcome to any one of you to celebrate this year's World Diabetes Day, focusing and highlighting diabetes at the workplace as a specific topic, how to improve the quality of life of people living with diabetes. I'm Professor Peter Schwarz. I'm Professor for Prevention and Care of Diabetes, and I'm the President of the International Diabetes Federation. And as president of the International Diabetes Federation, it's a great honor for me that you are celebrating the World Diabetes Day, because it is important to advocate for the need of people living with diabetes. It's important to fight against stigmatization for people living with diabetes. And it's important to look into strategies, how we can improve the life, the quality of life, the quality of access to diabetes care, and the availability of diabetes care for people living with diabetes. And this year's theme at the workplace is a very specific setting where you as an employer, but also you as an employee, work with your colleagues or work with your employees to build an environment where there is no stigmatization because of diabetes, where there is a chance to live openly with diabetes under your employees, and supporting your workforce, your employees, but there's no need to hide diabetes. Fighting against stigmatization for people living with diabetes is one of the main topics for the International Diabetes Federation. But we are not only fighting against diabetes at World Diabetes Day. This is an everyday activity for the International Diabetes Federation, and especially for me as a president of the organization. My heart is beating for prevention of diabetes. We have to think about how can we leverage activities for lifestyle change and prevention of diabetes. If we want to halt the rise and prevalence of diabetes worldwide, we have to focus on prevention. Maybe in the future, modern drugs may help to prevent diabetes, but the true way of preventing diabetes is lifestyle change, lifestyle change, lifestyle change. One of the main determinants of diabetes development is eating fried carbs. So reducing the consumption of fried carbs will be of benefit. This means healthy lifestyle change, but also the modern drugs like the GLP-1 analogs may help. But the most effective way in preventing diabetes is losing weight and, for example, doing fasting to improve the situation of your metabolism. Fasting is the fastest way to abolish the fat in the liver and the fat in the pancreas, which we today know are the main determinants for diabetes development. But there are also other aspects for this year's World Diabetes Day. Digitalization, especially the use of AI in diabetes care, is disruptive to the way how we deliver diabetes care. So what does it mean for the future? Will AI do diabetes care? Will AI in the hands of the technology company do diabetes care? Or is AI a brilliant tool in our hands as physicians to support our patients? Being in the pocket of our patient by using smartphones, by using modern technology, is a brilliant opportunity to foster lifestyle change, to support self-management of people living with diabetes. And AI may be a tool to be more precise and more specific for our individual needs as patients. So let's work on it together. Let's not fear this. Let's work together to develop artificial intelligence applications in our hands and use them in our environment for the benefit of people living with diabetes. But there are also new developments, like the development of type 5 diabetes. There's a very active group working worldwide on defining what is type 5 diabetes and how to diagnose, how to treat it. There are more than 50 million people living with type 5 diabetes, especially in Africa and Southeast Asia. We have to find them, and we have to be responsible that they are getting an adequate treatment. At the next ADA Congress, we will discuss this strategy very intensively. And at the next World Diabetes Congress, we will release a guideline about type 5 diabetes. But the main topic and this is related to today's World Diabetes Day, is advocacy for the need of people living with diabetes. And that's why I'm so proud that you are coming together, that you discuss this, that you become active to improve the understanding of the needs of people living with diabetes and fighting for those needs to be addressed. This, in my eyes, is patient advocacy. Let's work together. Let's be the ambassador for better diabetes care. Let's be the ambassador for the need for people living with diabetes. And let's use this year's World Diabetes Day as an occasion to highlight this, to shout this out, and to fight for addressing the need of people living with diabetes. I thank you a lot for your enthusiasm, your energy, your commitment. I thank you a lot for your actions.